Good evening and a very warm welcome to each and everyone. I welcome you on behalf of the Indian Dietetic Association Delhi chapter, and we're really grateful to our Indian Dietetic Association Delhi chapter for helping Good Monk organize a symposium on microscopic miracles, a symposium on gut health and essential nutrient synergy. I now invite Ms. Shilpa Chadda Thakur, a senior consultant in dietetics, Asian General Hospital, secretary at the IDA Delhi chapter, IAPM Delhi, a co-convener, a NetProfan Delhi chapter. I welcome you, Shilpa, to please introduce Anita ma'am.
Thank you so much. First of all, grateful and thankful to all the delegates who have joined today. On behalf of IDA Delhi chapter, I would like to welcome you all for this great symposium for which we have been all looking forward to. I would like to introduce our convener, Mrs. Anita Jatana, for the welcome address. She is the consultant dietetics in the Press Apollo Hospital Delhi and convener for IDA Delhi chapter and convener for NetProfan and vice president for IPN India. She has got 45 years of experience in the field of nutrition, and we all know ma'am, she is a renowned personality for us. I would like ma'am to take over for the welcome address.
Thank you so much, Shilpa, for those very, very kind words. A very, very warm welcome to everybody. A good evening and a warm welcome to absolutely. I think this is what has taught us, and not COVID, meeting everybody virtually and being able to give a virtual welcome to everybody on this platform. So we are here together to do Microscopic Miracles, a symposium on gut health and essential nutrient synergy, which is organized by IDA Delhi chapter in association with Good Monk. So welcome everybody. It's an immense pleasure and enthusiasm that I extend my warm greetings to the very eminent speakers and to each and every one of you present today. As we embark on this highly awaited probiotic symposium, let's get ready for a journey of discovery, innovation, and collaboration in the realm of health and wellness. We all know bad digestion is the root of all evil. I think we all agree with that. And as Hippocrates said long back, 460 BC, death sits in the bowels. We knew it since so long, but we still have a lot of questions which are unanswered. Since 70% of our immune system is located in the gut, and keeping it healthy is the key to good health, let's move on to unravel this mystery, which is still huge. We still need a lot of questions which need answering. It's been a very interesting and challenging journey to understand the brain-gut axis and its impact on various disease prevention and cure. The knowledge and insights to use or not to use probiotics, and for whom and when and how much to use. Still a query. The probiotics, the friendly bacteria is known for that, has garnered increasing attention in recent years for their profound impact on human health. From promoting digestive health to bolstering our immune system, the potential benefits of probiotics are vast and multifaceted. As we delve deeper into the science behind these microorganisms, we uncover new insights that have the power to challenge healthcare and improve the lives of millions around the globe. Over the course of the next 90 minutes, we will have the privilege of gaining knowledge from the leading experts and researchers who are at the forefront of probiotics research and development. Hope through this session, we will be able to explore the latest advancement in probiotic science, discuss emerging trends, and address key challenges facing the field and help us in our understanding of probiotics and harnessing their potential for greater good, and strive together toward improving health and well-being for all. So over to the experts to enlighten us on this very challenging topic, which has a great impact on health for all, from a newborn to the geriatric population. Once again, I extend my warmest welcome to each of you and express my sincere gratitude for your participation. So looking forward to a very interactive session and with a lot of take-home messages so that we can practice this with absolute confidence on our patients and for their well-being. Would now like to invite Dr. Sasikaran Goindala. I don't think he needs an introduction. Former director of NIN, ICMR Hyderabad, pathologist by training, has carried out research in the field of nutrition, food nutrition, has more than 120 publications and chapters in books, developed guidelines for probiotics in food. So you have the best authority going to be speaking to us today on probiotics. And as director of ICMR NIN between 2006 and 2012. Huge academic things to his credit, public trustee of ILSI, member governing body of Nutrition Foundation of India, member Society Advisory Committee, Gut Microbiota and Probiotic Science Foundation, chairman of the Scientific Advisory Committee of Protein, Food and Nutrition Development Association of India. The list goes on. So over to you, Dr. Sasikaran.
Thank you very much, Anitaji, and I thank the IDA Delhi chapter and the Superfoods with the brand of Good Monk for organizing this seminar today. And I also look forward to discussing with some of the other experts who will be participating later in the panel discussion. So let me first share the screen. Okay, I have titled my talk as the micro requirements for good health, because there are two micro substances which will be covered in this topic. The first one will be the micronutrients. The other one will be the microbiome. So after the presentations of these two, I will then try to share with you the information which is available on what are the evidences for the use of probiotics or prebiotics. And finally, is there a link between the microbiome and the micronutrient bioavailability? Now, we all know about hidden hunger. And now we also know it is not something which is associated with undernutrition, because it appears in all BMI categories. Even those who are overweight and obese also have multiple micronutrient deficiencies. Now, we know that we have the great problem of persistent childhood undernutrition with a lot of stunting and low weight for age. According to UNICEF, the major reason for the stagnant levels of undernutrition among Indian children is because they are undernourished even before they are born. So there is in utero undernutrition. And 50% of the growth failure which you see at 2 years of age in a child has already happened when even before the child was born. So it is very important that we address this fetal malnutrition first if we have to subsequently manage childhood malnutrition in this country. And anemia is another major micronutrient deficiency, and we have seen between National Family Health Survey 4 and 5, there has actually been an increase in the prevalence of anemia, particularly in children and as well as pregnant women. So iron deficiency anemia is a big problem. There was also a survey called the Comprehensive National Nutrition Survey, which targeted the adolescents between 2016 and 18, and it is good to know that the vitamin A deficiency has come down in our country. It was once quite a major cause of morbidity in young children. This is due to various public health programs. But vitamin D deficiency now seems to be rampant all over. And almost 34% of the women seem to be vitamin D, of the adolescent girls seem to be vitamin D deficient. Though in men it's only 14, it's probably because of a greater sunlight exposure among the boys than in the girls. Zinc deficiency, which is a cause for immune inadequacy, is still quite prevalent and is again second to iron deficiency. It is a micronutrient of concern for us. The other two deficiencies, apart from iron deficiency, which are also involved in hemoglobin synthesis, are vitamin B12 and folate deficiency. We initially thought that we may not have much B12 deficiency because the daily requirement is just 2 micrograms, but it invariably is coming from the bacteria. And therefore, the cleaner the environment and food, or probably the B12 deficiency is going to appear more often. But we are also concerned that in many of our population, the use of proton pump inhibitors, which actually reduce the gastric acidity, may also be contributing to the decreased intrinsic factor production and thereby lowering the dietary B12 absorption. Folate and B12 deficiency also play a major role in fetal programming. Many of Dr. Yagnik's studies have shown to the extent to which this deficiency can actually lead to low birth weight and also lifelong risk of non-communicable diseases. So this paper, which was published very recently, showed that iron, folate, vitamin D, as well as zinc levels significantly affect the odds of developing childhood overweight and obesity. So these micronutrient deficiencies are bringing in morbidities at various levels, and childhood obesity is a problem, and therefore we need to address that micronutrients are adequate as one more way of reducing childhood obesity. Now, this paper published 2010 showed that micronutrient status in fetal and early life may alter metabolism. This is what even Yagnik group have shown. In the process, what happens is that the vasculature, which are the blood vessels in our body, turn out to be much thinner and harder, and therefore greater risk of vascular insufficiency to the organs, leading to several cardiometabolic disorders. And many of the physicians and surgeons feel that the size of the size of the heart among the Indian, as well as the kidneys, are much smaller than what it is in the Western population. And there's also a possibility that the insulin synthesis is suboptimal. And all these are related somehow or other due to fetal micronutrient deficiency. Now, there has also been a recent study of interest because most of you were probably also dealing with patients with diabetes. The diabetic foot ulcers are a common complication, and micronutrient deficiencies are seen to be associated with non-healing of the diabetic foot ulcers. So the next time any of you are managing patients with this, best is to check whether their micronutrient status is adequate. Now, this study was published recently in PLOS One by Shaili Avasthi, and then this study was between 19 to 2020. It's a multi-center cross-sectional study. It covered 60 schools across 10 cities. The prevalence of these deficiencies, of course, this adds to in addition to the NFHS data, which I told you, that 60% of school children are calcium deficient. And you also find that 40% of vitamin D deficient. So in combination of vitamin D deficiency and calcium deficiency in school children, what will be the outcome? Outcome is they will have thinner bones, and this will make them prone to osteoporosis at the later age. Iron deficiency, I've already mentioned. Similarly, B12 deficiency, folate, selenium, zinc, all these were observed exactly as was seen under the National Family Health Survey. Vitamin D deficiency, fortunately, was only 1.6%. So even though there was 60% iron deficiency, anemia was prevalent in about 17.6% of the subjects because due to multiple micronutrient deficiencies. Osteoporosis is a problem, especially in the elderly and the postmenopausal age. Though there are some non-modifiable risk factors, there are many of them are modifiable, especially calcium and vitamin D intake, exercise, and so on. Again, the Asians are at a disadvantage in the sense that Indian women have 5 to 15% lower bone mineral density than the non-Asian women. And a paper published in 2015 said that 46 million women more than 50 years of age are at risk of osteoporosis in India. And this many women with osteoporosis, if they live along, they are very prone to fractures. And you know that fractures is one of the most morbid issues in the elderly. So anti-osteoporotic treatment is indicated in individuals who are over 50 years whose DEXA, dual photon X-ray absorptiometer data, shows a T-score less than 2.5 either at the femoral neck or at the hip or at the lumbar spine. The anti-osteoporotic treatment has to be initiated. But the best, of course, is to start by making sure adequate calcium and vitamin D is available for adolescents, particularly the girls. The fundamentals of osteoporosis therapy is, of course, that you should have a 25-hydroxy vitamin D of more than 20 nanograms per ml in all patients with osteoporosis, but you should try to achieve 30 to 40 nanograms. There's no other option but to supplement vitamin D3, even though sunlight exposure will be able to help. But in the elderly, it may not be able to generate that amount of cholecalciferol. So higher doses of vitamin D have to be given to individuals who are obese. For the simple reason, the fat-soluble vitamin D could get sequestrated in the adipose tissue. And therefore, we have to counsel patients on their dietary calcium intakes. The total intake from all sources, food and supplements, should be at least 1,000 milligrams per day for any woman who is more than 50 years of age. Now, with this broad bird's eye view of the kind of micronutrient deficiencies which are existing in our population, we then move on to the next part. It's about the gut microbiota. So the gut microbiota starts right from the day the child is born. And initially, the bacteria come actually from the vaginal passage during the childbirth itself. And that's one of the reasons why there is evidence to show that the cesarean-born children, we have a disadvantage of a couple of days before their guts get colonized, unlike the ones which are born through the natural way. And then as age advances, depending upon the kind of food which the children eat or later on during adulthood, the kind of bacterial population keeps varying and it keeps changing. So it is a dynamic situation. There's nothing like a standard gut microbiome picture. Now, gut microbiome has become very important now because most of the immune system is located in the intestinal epithelium. And with 70% of the immune system being in the gut, it is necessary that we have a healthy gut so that we have a better immunity. Immunity is not only to fight infection, we also do not want excess of an immunity too, because too much of immune stimulation, because of the presence of bad bacteria in the gut, results in a situation called as chronic systemic inflammation, which in turn is responsible for many non-communicable diseases. Among all the various functions which you are familiar with, the last one on the right is the generation of short-chain fatty acids. We will come back to it later to see how important this short-chain fatty acid is going to be. Now, the balance of good and bad microbes is what we are ultimately striving, and whether it is probiotic therapy or whether it is fecal microbial transplantation, any of these methods are ultimately to make sure that the bacteria which you see on the right side in blue outnumber the ones on the left side which are in red. So whenever there is a disturbance in this balance, we call it a dysbiosis. It could be a taxonomic dysbiosis in the sense that you have the wrong species, wrong strains of bacteria, and the wrong ones are much more than the good ones. Or you could still have only good bacteria, but either because of diminished number or diminished, the capacity, you could get also a situation which is called as functional dysbiosis. These are the situations where we consider probiotics as a therapy. So there are various interventions available for us. We call it as targeted interventions, which we want to talk about. Mostly it is drug-based. Untargeted, of course, is a good diet with sufficient prebiotic and possibly some naturally available traditional fermented foods with established probiotic bacteria. or exercise, or by giving as supplements probiotics as well as prebiotic. And now we are also looking at postbiotics, which are the metabolites of the bacteria. It's still not come into regular practice, but they're still in the research stage. But the days are not very far off when they would also become like new wave nutraceuticals. Now you look at the food. Our food itself is an immune sensitizer. We don't have to go toward supplement if we can only take natural food. The right kind of food will give us a good, healthy microbiome. And we could consume either probiotics through foods or through fortified foods. But even more important than that is to consume the prebiotic, which are dietary fibers, which come from vegetables, fruits, and whole grains. The disadvantage of modern type of highly refined foods is that they will not provide us the prebiotic. When you look at this, the various sources of prebiotics on the left, they come from those conventional foods or foods which are fortified with prebiotics or prebiotics directly given as a supplement. Similarly, on the right side, you see probiotics. They could come as right on top through fermented foods. And here I wish to state that not all fermented foods will have probiotics. Even if there is a fermented food which has got probiotic, when we heat the food, the gut bacteria would die. There may be some traditional fermented food where someone has worked out what the consortium of bacteria are, and if it follows the principles of a probiotic, that is, they survive digestion, that they colonize and they proliferate in the gut, then all fermented food will also have probiotics. Otherwise, you have products which are fortified with probiotics, or you can directly get a probiotics as a dietary supplement. So what are the characteristics of a prebiotic? Are all foods prebiotics? The answer is no. Prebiotics are the non-digestible components, and they are mainly oligosaccharides. If you see the carbohydrates may be either single molecules, which are called as monosaccharides, the glucose or fructose or galactose, or they can be disaccharides like sucrose or lactose. And oligosaccharides have anywhere from 3 to 5 sugar molecules in them. Those are the ones which the bacteria like. They don't like monosaccharides and disaccharides. In fact, more of mono and disaccharide actually will give a bad gut. So these stimulate the growth of the beneficial intestinal bacteria. Just as probiotics should not get destroyed by gastric and intestinal digestion, prebiotics should also have the same feature. And they should all be fermentable by the gut bacteria. Only then you call that as a prebiotic. There are other beneficial effects of prebiotics other than letting the good bacteria grow are that they control the intestinal transit time and bowel habits. A food with adequate prebiotics will help relieve constipation or even regularize bowel habits. They also reduce the risk of infection and allergy because prebiotics themselves have a bacteria binding capacity and allergen mopping up capacity. Then the biological effects of prebiotic will depend on the influence on the gut bacterial composition and the derived metabolites, in the sense that, not all prebiotics will be beneficial to all the gut bacteria. You need to have a variety of prebiotics. And as I mentioned just now, prebiotics may inhibit pathogen adhesion because the prebiotics structure is said to be very similar to the bacterial binding site on the intestinal epithelial cells. So the bacteria may therefore bind to prebiotic instead of the intestine and thereby reduce the risk of any pathogenesis. Now, common prebiotics are the oligosaccharides, as I mentioned, is the galacto-oligosaccharides and inulin, which gives rise to fructo-oligosaccharides, or whose derivative is fructans. Galacto-oligosaccharide is about 3 to 4 molecules of galactose which come together, and they are found in milk, particularly human milk. And they're called as human milk oligosaccharides. And these specifically promote the growth of bifidobacteria. It is nature's way of providing prebiotic to the baby right from the time it's born, so that it specifically helps bifidobacteria grow. Now, there are a lot of infant formulas also have HMOs as a component. The galacto-oligosaccharides also have the capacity of pathogen binding. And that is how children who are breastfed have less number of GI problems than children who are formula fed, because the human milk oligosaccharide acts as a bacterial sink. Inulin is commonly found in plant foods, especially in onions, wheat, asparagus, artichoke, and so on. Fortunately, we use a lot of onions in the country, in most parts of the country. They help in modulation of the gut bacteria, and they also have the capacity of preventing pathogens from adhering to the gut. So the inulin derivatives, inulin as well as the derivatives, help colonization of the gut bacteria, good bacteria, and also induce anti-inflammatory effect. They modulate bowel habit, and they're known to regulate the alterations in lipid and glucose metabolism. See, one of the products of prebiotic fermentation by the gut bacteria are short-chain fatty acids. And among them, propionic acid is one of them. And propionic acid directly gets into the portal circulation from the gut. And there it is involved in the control of the gluconeogenesis. And that is how the link between the gut bacteria and glucose homeostasis seems to be happening. These are all facts which we have been learning over the last decade or so. So inulin also stimulates bifidobacteria and lactobacillus. And as I mentioned, short-chain fatty acids have got a very major biochemical role in the metabolic pathways. There are also others like inulin, which are non-starchy carbohydrates. These include cellulose, dextrins, chitins. Chitins come from mushrooms, pectins from fruits, beta-glucan from oats, and some waxes, and lignin. And these all have an inulin-like action. And these compounds are found in many foods, such as cereals, nuts, etc. And they are also fermented, and they specifically help promote the growth of bifido and lactobacilli. And they are also involved in the strengthening the gut barrier. Now we look at the role of gut microbiome on polyphenols. You know, polyphenols are all known as bioactive molecules in vegetables, fruits, and whole grains. And these are known to have a lot of health benefits. But they are present in minuscule quantities, and their bioavailability is also very limited. Recent data has shown that the gut bacteria actually modulate these polyphenols and make them more active and make them more bioavailable. So the microbial metabolites of the polyphenols are better absorbed. And not only that, once they are absorbed in that part of the intestine, they go directly through the portal circulation into the liver. Unlike polyphenols which get absorbed in the upper part of the gastrointestinal tract, once they enter it, in a very short while, they go into the kidney and get excreted. So the half-life as well as the biological activity of a polyphenol increases if there are good gut bacteria which are able to transform them. Now, where is the evidence that gut microbes actually activate polyphenols? One of the best evidences is from soya. Soy has two estrogen-like substances. You are fully aware. One is called daidzein, another is called genstin. It is found that soy consumption does not give enough estrogen-like action in the Western population, unlike it does in the Asian population. The reason is the Asian gut bacteria actually bioactivate the daidzein into equal. And the equal is an isoflavone, more potent than daidzein or genstin, and has an estrogen-like action. And this estrogen-like action is a beneficial action in the sense that it helps in preventing osteoporosis, it also helps in reducing the risk of developing breast cancer. So this is the best evidence how gut bacteria actually modify natural polyphenols into biologically active compounds. The flavonoid quercetin, which is present in vegetables, and the gut microbial enzymes actually activate them. They are present in a glycosylated form in the vegetables, but they get activated into an active form of quercetin, which downregulates the intestinal inflammatory responses. So this shows the interlink between microbiomes and polyphenols. The several phytochemicals like resveratrol in wine or anthocyanins in berries and pomegranate and T catechins, all these are also beneficial for the growth of good gut bacteria like bifidobacteria or lactobacillus. Anthocyanins from berries are also known to have a pathogen binding capacity, and they're known to inhibit the survival of Staphylococcus, Salmonella, and Helicobacter species in the gut. T catechins have an advantage of they modify the intestinal mucin in the ileum and then make it difficult for any bacteria to stick on to the inside of the gut. Now, what are the various strategies to assess the impact? For example, if you have something which is a suspect prebiotic, what should you do? You should first do a fermentability assay and see whether you're able to generate fatty acids. So you put the prebiotic and put a known bacterial culture and see it generates organic acids. If it does, then next you do a human gastrointestinal simulation test and see whether it helps multiply the bacteria. And subsequently, if you do find that the prebiotic is helping the bacterial culture grow, then you go on and do a clinical trial to establish its efficacy. And this slide also shows how a proper clinical trial should be done. So this was a trial on a particular prebiotic, and based on the calculation, they had sample size of around 40 patients. And then they divided it into two groups. Initially, they sort of stabilized them on the matrix. In this case, they used milk. And then subsequently, they did all the various investigations. So we need to have a good, robust, randomized, double-blind or a single-blind study group. And unless you have these kind, nobody will accept our data that you have a potent prebiotic or a good probiotic with you. Now, we always have two sets of people, those who believe that probiotics work and those who don't believe that probiotics work. Many think it is just a placebo, there's not enough science. I think Neerja will bear out on me. In the last 14 years, we have been having meetings. The initial 5 meetings or 6 meetings, everybody almost laughed at the whole issue of probiotics. And now, slowly, everything has changed. So what is it we know? We know that probiotic supplementation has beneficial effects on human health. We know that the microbes in our gut influence our energy metabolism. We know that diet and medication have a strong influence of gut microbiome composition. Wrong diet, too much medication will destroy the gut microbiota. The microbe composition influences the response of chemotherapy. This was a new science which has come up saying that in cancer chemotherapy, some patients respond adversely. Efficacy also is suboptimal in some patients. It has been depends upon the gut bacteria of these patients. So looking at the gut microbiome may be a good prelude to chemotherapy. And some of the drugs may actually get modified by the gut and thereby either make it less efficacious or also may enhance its half-life and thereby make them more toxic. So it is proposed that in future, new drug development should also include the effect of the drug in the clinical trials on the volunteers' gut bacteria. And microbe composition in the gut also defines the glucose response to foods. And therefore, if you do a personalized diet, you need to also make sure that you attend to the gut microbiome composition. And dietary fiber, of course, we know influence. So what is it we don't know? What we don't know is, are natural probiotics in food better than probiotic supplements? And whether we need to take probiotics preventively. There are studies where shown that it can prevent certain diarrheal diseases, but still this is not come into standard practice. Now, can the microbes influence food choices and appetite? So here, this is where the gut-brain axis comes in. Do low-dose antibiotics in food affect human health? You know that we have small amounts of antibiotic in the poultry and in some of the meat products. Will these be affecting our gut health? It should be interesting. Do pesticides change the gut microbiome? Are organic food better for gut microbiota? And should all new drugs and food chemicals be tested for gut microbiota? Now we come to the final part of my presentation. Is there a link between gut microbiome and the micronutrient bioavailability? So gut microbes are present throughout the GI tract and not necessarily only in the end of the, we have a wrong impression that these gut bacteria are present only at the terminal port of the colon. So whatever they generate there may not be absorbed and therefore it won't work. But you should remember there are the proximal part of the large bowel and the ileocecal junction is still an absorbed surface. And they interact, gut bacteria interact with micronutrients in food, and they may influence the micronutrient absorption and the bioavailability. So this is a publication which came last year, where they show that on top you see the prebiotic material getting into the gut, and you see the gut bacteria on the left, and you see the minerals and vitamins there. And you see that butyric acid, acetate, propionic, all the short-chain fatty acids mingling with the minerals and the vitamins. And these are known to improve the bioavailability. So there is an interaction between the gut microbiome and micronutrients. And so we need to look at how much they can actually enhance the bioavailability. Since bioavailability is always a problem for us. So that is the link which I could establish between microbiome and gut bacteria and microbiome and micronutrients. It is still very in the early stages, and there will be research soon which will tell us that you give iron fortification. Now we say vitamin C enhances iron absorption. There'll probably be a time when they'll say lactobacillus enhances iron absorption, and therefore we use it in the public health programs. So thank you very much. I hope I have not exceeded the time, and we'll be happy later on if you need any clarity. Thank you so much.
Dr. Sasikaran, that was amazing. You took us through the whole journey and you still put us in a thought process. Where do we stand today? You still say there are gray areas. Though over 2 decades, I feel very confident using it. I still remember bombarding Dr. Nirja about it when she first approached me. These are probiotics. I said, why? What's wrong with curds that we've been doing over centuries? So with a lot of science and a lot of, as you said, over 14 years or maybe 2 decades, we've been hearing about probiotics and so much of science that has gone in. We're using it with a lot of improvement in patients. I've used it for celiac, ulcerative colitis. I've used it for diarrhea, antibiotic diarrhea, especially in hospitals. And we've seen some excellent results with our patients. I have my own personal experience with my mother. She sailed through her chemo and radiation and had put on probiotics. And, she just sailed through. She didn't have any side effects with mouth ulcers or vomiting or diarrhea. So not saying that she didn't take a good diet with it, but we've seen a lot of advantages. So at the end of it, you put a query. Should we use it for patients as preventive? My question is, why not? Before we open the panel discussion, my question to you. Why can't we do it? We've seen good results. I'm doing it myself personally. And I think you keep a healthy gut, you're a healthy you.
Yeah, it would again depend upon what you're trying to prevent. So in fact, we have had
good
experience.
Just good health.
Oh yeah, good health. So So we have to have a good placebo control study whether that probiotic actually, what did it prevent? Did it prevent or
Karan,
whole
we'll
lot
never
of
be able to
infection?
have that. We'll never be
Or,
able to have those control studies
yeah,
in a
yeah.
human
So
being.
since it is known to be linked to immune function, it is
Yeah.
also known to be associated with reducing inflammatory load. It is logical that the right kind of probiotic, if they're genuinely getting colonized and growing in the gut, those benefits will occur.
Yeah. So I think we are good to go. Yeah. So over to you, Sheetal.
Thank you so much, ma'am. At the outset, I'd really like to thank Dr. Shashikaran. Sir, your expertise in gut health has today seamlessly helped us navigate and better understand the complexities of micro requirements and also micromolecules that we may not be considering in active practice. Today, you've also shed light on how these complex components play an enormous role in maintaining our health, whether it's respect to absorption of nutrients or whether it's respect to osteoporosis, as well as cancer. Thank you so much, sir, today for helping translate scientific knowledge into practical insights for us to take away back for our practice. I would like to, before we begin the panel discussion, I would like to take about 7 minutes to have a quick presentation on a short clinical that we have done. I'll just be sharing my screen. So we have done an intervention open label prospective single arm clinical study of Good Monk family nutrition mix for the assessment of gut health, energy enhancement, immune supportive properties, growth, and well-being on a healthy population. Our primary objective was to assess the efficacy of 4.6 gram dose of Good Monk formulation in the management of gut health, energy enhancement, and immune support, growth, and overall well-being of a healthy population 13 to 35 years. Our secondary objective was to assess the safety and tolerability and further support our primary objective of gut health, energy, and immunity. Subjects were advised to take 2 sachets of Good Monk daily, 1 mixed with their morning or afternoon meal, and 1 mixed with their night meal for 120 days. The intake of the product was recorded in a daily diary that was issued to them. If there were missed doses, that was also recorded. We had a total of 72 subjects, 17 adolescents, 55 adults. This study was done in Bangalore, led by an external CRO and an independent ethics committee for 120 days. Well, the results we got were 95% users reported an improvement in gut health, energy, and immunity. So hence, we do conclude that if Good Monk 2 sachets a day, that is 4.6 grams of Good Monk is taken regularly over 120 days, it does show a promise in improving gut health, energy, and immunity. So the composition of the product was that per sachet, we aimed at giving 30% of the daily nutrient requirement. So we had primarily probiotics, we've got Bacillus coagulans. And then for fiber, we've got FOS, that is 1.6 gram. And then we've got vitamin A and D as the fat-soluble vitamins, B6, B9, B12 as the water-soluble vitamins, and vitamin C as a water-soluble vitamin. For iron, we've got sodium ion EDTA, which is a highly bioavailable salt. So 5.6 mg, that is about 30%. So 2 sachets on an average would give anywhere between 45 to 60%, depending on the daily nutrition requirement of children as well as adults. And along with that, we have 2 herbs, that is KSM 66, ashwagandha, as well as Brahmi. So the first is the gut health assessment that we've done. Over here, as you see in 72 subjects, we have seen that there is a reduction in the gut health score. Here, the reduction in the gut health score indicates an improvement in gut health. Thus, at 60 days, if we see, it is approximately a 50% improvement. And over 120 days, it's anywhere around 90% improvement in adolescents and adults. For the gut health, we also use the Bristol stool chart. It was remarkable to note that at the baseline, 32% of the population reported in type 2 category. That is, they had a type 2 stool, which is average. And in 30 days, there was an 18% reduction. At day 60, there was an 11% improvement. And at day 120, actually, we have seen that almost 60% of participants actually improved into the type 3 and type 4. That is the normal category. So here we see that at day 0, actually, if you see only 12% of adolescents, they had, sorry, just one moment. So we see that 12% of participants over here actually showed that they had a normal stool type, which means the rest of the participants, that is 78% of participants actually had a stool type of either 2, 5, or 6. We found very minimal participants in type 1 and type 7. It improved to 48% in adolescents in 30 days, which was a higher jump in adolescents, and then 71% in 60 days and 95% in 120 days. In adults, we have observed that 35% of the population actually reported a normal stool type, which actually showed a reduction, which means they actually experienced a little bit of bloating. And that was expected because of the FOS that is there in the product. But on consistent usage, it has actually shown a remarkable improvement to 54.2% in 60 days, and then a 92.8% of normal stool type in 120 days. The 30 seconds sit and stand test was done for both adolescents and adults at day 0 as well as at day 120 for all the participants. This was done in person. Over here, we have seen that the score was actually 13.29 for adolescents, and there was a 24% improvement within 120 days for both adolescents as well as adults. The CRP levels, as we have seen, are a direct indicator of inflammation. At day 0, we saw that the CRP levels amongst adolescents was 6.08 as a mean value. As for adults, it was 7.32, which in 120 days actually reduced for adolescents to 3.35 and adults at 3.95 respectively. For vitamin D, we have seen a marginal improvement. We have seen that the adolescents on an average had a score of 12.8, and at 120 days it was 16.26. So 26% improvement was observed, and 30.45 for adults and 16.92 for at 120 days was observed. For serum iron, we have seen that at day 0 it was 88.44%, and at day 120 it was 113, which showed a significant improvement of 30%. And for adults, it was 70.78 and 93.27. When we have seen that in females who reported a lower range of serum iron levels at baseline, you can see the median is 36, the mean value is 44.11, and the serum iron levels actually improved to 76.04. That is almost a 2 times increase that has been observed for women or female subjects, I would say, who had a lower range of serum iron levels. The B12 levels saw a remarkable improvement. And over here, we can see that in adolescents, there is, as well as adults, there's almost a 100-point jump that has been observed at the end of 120 days. Well, for the secondary outcomes, we have the ISQ score, which is a great indicator for immunity. Again, over here, like the gut health assessment score, the lower the score, the better is the improvement in immunity. So initially, a high score was observed. And over there, we have seen that there is a reduction in the score. At 30 days, 35% approximately, you can say 33% reduction is there in both adolescents and adults. At 60 days, it is around 65%. And at 120 days, there's a very remarkable improvement. That is a reduction in headache, reduction in fever, reduction in allergies, and a reduction in recovery time from frequent illnesses such as cold, cough, and fever of 90%, 92% in 120 days consistent usage. Well, the quality of life score, we also assess the stamina and fitness. Over here, we have seen a remarkable improvement that has been around 38% improvement has been observed in 120 days. So to conclude, I would like to say that on regular consumption of 2 sachets a day, that is 4.6 grams of Good Monk for 120 days results in a 95% improvement in gut health, energy, and immunity that is experienced by participants. Thank you so very much. I would now like to move on to our panel discussion. So for the panel discussion, I would like to say today's topic is gut intelligence. I would just like to welcome all the panelists. Yes. Well, we have our very own Sheila Krishnaswamy ma'am. She's a registered dietitian with 40 years of experience in the clinical, corporate, and communication spaces pan-India. She's trained in India as well as overseas. She's pioneered nutrition consulting in corporate companies and guided a lot of us. She's actively involved in national and international dietetic associations and has held leadership positions in both. She has had a mainstream media presence for the last 27 years. Formerly a nutrition entrepreneur, an editor, a public speaker, and a blogger. Currently, she is a nutrition and wellness consultant and works independently as an advisor, a writer and anchor, a speaker, and a corporate trainer. So welcome very much, Sheila ma'am. I would now like to welcome Malika ma'am. Malika ma'am, as all of us would know, she's a nutrition business strategy consultant, and she's also been an advisor and a consultant. She's worked, she's actually scored remarkable grades right through her education. As I was going through ma'am's LinkedIn, 25 years of experience in food, nutrition, and nutraceutical industry. She's initially studied MSc in food and nutrition. She has also done her master's in food service management and dietetics. And then she's further gone on to actually study a postgraduate certificate in commercialization and entrepreneurship from the University of Auckland, and then further studied social media marketing at Unitech. Ma'am, you are a true inspiration for all of us to continue studying and expanding the horizon of nutrition. She's been the nutrition manager for the South Asian region at Nestle India. She's been the VP Nutrition and Head Policy at PepsiCo. She's a strategic advisor at the Asian Network Inc. She's the founder and chairperson of the Vahini Charitable Trust. She's very, very passionate about anemia. She's also the director at the NutriQ 360. So welcome very much, ma'am. Then we have Dr. Neerja. And Dr. Neerja, all of us associate with, thanks to you, we have a knowledge on probiotics. You've introduced this to us from the very beginning. So we all are very grateful for that, Neerja ma'am. She's the head of science and regulatory affairs at Yakult. She's got more than 20 years experience in developing, planning, and implementing scientific programs and appraising scientific information and adapted written and oral communication to a range of audiences, that is healthcare professionals, media, as well as consumers. She's a leader. She's led multidisciplinary teams, organized wide outreach programs. I think all of us associate probiotics with Neerja ma'am. We always go to her for guidance. She's a key opinion leader, both at national as well as global level. And so welcome very much, Neerja ma'am. Anita ma'am, I cannot thank you enough for your support in organizing this CNE. It wouldn't have been possible without you. So Anita Jatana ma'am, she's a consultant dietetics, Indraprastha and Apollo Hospital at Delhi. She's a convener for the Delhi IDA chapter. She's also a convener for NetProfan and she's the Vice President of IAPN India Delhi chapter. She's got 45 years of experience. She's won Lifetime Achievement Awards. She's also a certified diabetes educator and SPEN LLL courses on renal critical care and parental care. Ma'am, thank you so much for being here. Dr. Shashikaran, thank you so much for a wonderful talk. Anita ma'am has already introduced, so I wouldn't say too much, but thank you so much, sir. We've learned extremely well today. And we have Shobhan Ganguly, sir. Sir has done his organic chemistry at Rutgers University, New Jersey, USA. He's also done studied at University of Delhi. He's a visiting faculty at TDU. He's the Senior Vice President and Head at Technical Center at Diageo. He was the Platform Director, Bioscience, Nutrition, Health at Unilever. He was the Global Capacity Owner, Food Chemistry, Unilever. And he was also the Division Head and Program Leader for Beverages at Unilever. So thank you so very much. At this moment, I will now start the panel discussion. Anita Jatana ma'am, please could you switch on your video? So yes, it's a very interesting topic that we have today, gut intelligence. What is gut intelligence? Earlier, when I remember studying 18 years ago, it was just a digestive organ, and then we've learned so much. So without taking any more time from the panelists, I would like to begin with my first question for Anita Jatana ma'am.
Yeah. Should we go ahead? Hello? Can you hear me? Yeah,
yes, ma'am, we can hear you.
Yeah, my answer is very, very easy now. Dr. Shashikaran has just placed it absolutely on a platter for me. Gut health is very important. As you said, you only thought of, just looking after intestines, but simple, but yet very, very difficult to achieve. I think with the changing trends with our food habits, we are asking for trouble, and we've seen a lot of change in the diseases which are now coming up. Earlier, you never saw celiac in the older age because you always thought celiac was an allergy food, to wheat, and it only happened in childhood. But today, you're seeing it in the older generation. So it's obviously something to do with gut health, and it's obviously something to do with the food that we are eating these days. So we moved away from our traditional food, which already had a lot of, today we have words for it. Earlier, we just thought it was healthy food. Today, we know it had prebiotics, and together with fiber and soluble fibers, it was a very healthy Indian thali that we were consuming. Today, we are going more and more towards fast foods, which are loaded with sugars and fats, which are definitely affecting our gut health. So if we move back to, eating our traditional food, including a lot of grains, having a lot of vegetables, fruits, which are obviously loaded with soluble and insoluble fibers, it will happen automatically if you had these food in your diet. Millets are a new thing that are happening, but with a word of caution, don't take millets the whole day. Just take about 1/3 of your carbohydrates from millets. Again, there are better fibers in millets. Include, there's a lot of science, and there's been a study which says that vegetarian food is better than non-vegetarian food. Again, the answers are simple. The vegetarian food comes with fibers, whereas non-vegetarian food doesn't have fiber. So including both soluble and insoluble fibers are important. But just that is not enough. We definitely need to include a lot of be hydrated, make sure that we've taken our polyphenols, we've taken antioxidants from our vegetables and fruits, avoid stress. Exercise is important, very, very important. Maintain the circadian circle, sleep on time, get up on time. Today you're seeing everybody going topsy-turvy, awake through the night and sleeping late, no exercising and scheduling program, too much of stress. We are working and eating together. We are watching TV and eating together. So we are not actually letting our mind get synthesized to the food that we are eating. So the gut-brain axis is not being maintained, which is so, so important. You've just heard Dr. Shashikaran say that. No smoking, avoid alcohol, avoid sweets. It's absolutely the new cocaine. It's absolutely, and there's artificial sweeteners. People have started just taking the non-sweetened beverages, the zero Coke and all, which are worse than taking a little sugar occasionally. So avoiding those foods definitely are important in our daily diet.
Thank you so much, ma'am. Ma'am, my next question to you is Sheila, ma'am. How does a leaky gut influence systemic inflammation in the gut and thereby disrupt both macro and micronutrient absorption? And what strategies could you suggest for us so that we can target gut health as an improvement for overall wellness?
Thank you, Sheetal, for that question. As we all know, micronutrients are absorbed in the small intestine, and in the colon, the short chain fatty acids and the electrolytes are absorbed. And we also know that a leaky gut is caused by poor diet and poor lifestyle, and this in turn can lead to inflammation. When there is inflammation, there is malabsorption of all the nutrients that are affected. And chronic inflammation can reduce the transit time in the gut, and this can in turn lead to less nutrients being absorbed. And again, chronic inflammation also leads to many chronic diseases, metabolic diseases like CVD, cancer, diabetes, and so on. Inflammation can be caused by faulty eating habits. I think Anita has already mentioned about this, or stress, or environmental factors, or a combination of all of these. Now, coming to the second part of your question, an anti-inflammatory diet. Again, Anita has talked about eating a balanced meal, eating a variety of foods, including all food groups, eating whole grains, plant proteins, vegetables, fruits, nuts, seeds, spices, which contain bioactive components, can help to prevent or reduce inflammation in the body. And this in turn will help in better absorption of nutrients throughout the gut. So basically, we need to include more fiber, which as prebiotics help in better gut health, reduce the ratio of omega-6 to omega-3 fatty acids, avoid sugars, or at least take in minimal quantities. And like Dr. Shashikiran said in his talk, mono and disaccharides are disliked by gut bacteria. I really like that sentence. So I think we need to reduce or avoid sugars, reduce high fat and foods and fried items, and definitely try and avoid ultra processed foods. I think this goes a long way in improving the gut health and also reducing inflammation. Even probiotics, I mean, Neerja is the expert here in probiotics, but even probiotics can help in reducing inflammation because it helps to improve the gut eubiosis, or rather reduces the gut dysbiosis, also leaky gut, and improves the gut barrier function. And this in turn can help in reducing CRP levels, IL-4, IL-6, TNF-alpha, and other pro-inflammatory cytokines. So overall, it's important to include a healthy diet and probably, if necessary, supplement it with, things like probiotics. In fact, this morning I came across a review article that said that including probiotics can actually increase the lactobacillus, I think Casey and Neerja, I sent you this message. Casey and what was the other one? I forgot. Acidophilus. Yeah, thank you. And increases that, and that in turn can actually increase the enzymes superoxide dismutase and catalase. So this is like I said, Neerja already knows all of this, but this is the first time I came across this article, and I was very excited, and immediately I texted her. So yes, probiotics can help, and overall good, healthy, balanced meal and good lifestyle can also help. Thank you.
Thank you so much, Sheila ma'am. Yes, that is very true. In fact, at the last CNE, we had a very nice debate when Shashikaran sir actually mentioned that the curd you are eating the bacteria really doesn't reach your gut, and everybody was, discussing that. So yes, it is extremely important to not only go back to our health, but also I think learning and understanding where probiotics work and prebiotics work. So therefore, my next question is to Mallika ma'am. Mallika ma'am, can the modulation of gut microbiota to pre and probiotics contribute to an improved absorption of micronutrients? Especially, what is your take on iron and vitamin B12 absorption? And would an intervention to modulate the gut microbiota be useful? And how do we actually translate this knowledge into practical dietary recommendations? I know today morning, even I messaged Mallika ma'am and I shared, ma'am, this is the controversy that we were discussing. So, ma'am, please guide us. Ma'am, you're on mute.
Good evening, everybody. It's early morning for me, just past midnight. I think Sheetal made us really have the second brain working. So we all of us were looking at researching, reading. And I came back to a very simple thing. I remember when I used to teach at the hotel management and give talk, I would say the best way to a man's heart is through the stomach. And I said somewhere down the line, we had so much of it that it became a traffic jam and didn't go to the heart in the right way. And maybe that whole proverb was said lightly, but had something to say that take care of the gut health, take care of the food that you eat. And that gut is the temple of health. And as we progress now, as we learn as people who have an interface with the consumer, with the public, we get so much of information, and then how do you decode it? How do you simplify it? And how do you motivate a customer or your patient to really have a behavior modification? I think that has been my challenge, because I always felt I could go back for science to people who know science. But for me, I become the wire media between the science and the consumer. How do you keep decoding every time and simplifying it? It's very important to simplify so much information that we get. So your question actually has something that I really wanted it, and because there's some truth in it, some facts in it, and therefore some myths in it. So your question about can the modulation of gut microbiota through prebiotics contribute to improved iron and vitamin B12? Well, there are studies that are coming up. There are a few human studies that I looked up, some recent studies. We need to understand where the action is actually happening. When you look at the gut microbiota, though we know that the microbes are there across the body, starting from the mouth to the small intestine to the large intestine. And mostly we study about the gut microbiome in the large intestine. So when the absorption of iron, if you take, and these are two different things, though iron and B12 help in forming red cells, you find that both of them, the absorption takes place in the small intestine, the villi. So there are two different things that happen. When you take the prebiotics, which is fiber, non-digestible, and because it's non-digestible, it naturally gets into the large intestine. It escapes all the hardships along the way and comes to the large intestine. Whereas early on, whatever nutrients come in, like the B12 or the iron, will get either absorbed, or if they don't get absorbed for various reasons why anemia is what it is today, then they would come to the large intestine as unabsorbed. But prebiotics have a very different function. They do help in gut health, as we all know. They work along with probiotics. They are the food for probiotics. And prebiotics are food for good bacteria. And some of the prebiotics are food for bad bacteria also. So you should understand when you give prebiotics, both the bacteria, the good and the bad, are also going to survive. And there are some prebiotics that help more of good bacteria than small bacteria. So there's a whole science behind that. And then if the gut health improves, inflammation, anti-inflammatory, the inflammatory risk factors are reduced, immunity is improved, the other risk factors of having more, the pH being reduced and therefore the risk of heart disease getting reduced, all these good things will have a role to play in the overall health, and maybe over a period of time when the gut health improves, we might have better absorption because there's less inflammation. However, and that I will leave it to Dr. Shashikaran to find out, is there a second absorption that can happen? And if at all, will it happen in the large intestine? For example, when we were students, we were said, don't worry about B12, though you're a vegan. In the hygiene standards are not good, so therefore you're still going to have B12. I hear another story that no, but that B12 is not absorbable and therefore it's not available. So these are the signs that will keep evolving. So what we need to do from a very consumer-facing responsibility, decode these to simplify it to your prescription that you're going to give as a positive prescription. And therefore tell them why gut health is important. Very simple. They would like to have a good, happy gut health for reasons of immunity, because post-COVID, everybody understands why they have to develop immunity. Second, how inflammation. You can explain to them what are simple things like inflammation is just the soreness. And I know I deal with one bioactive compound, and I realize that even little exposure to the lactoferrin actually reduces the inflammation. So the soreness goes up, even if you use it as a cream on the skin. So, and people understand inflammation. People understand the soreness. They understand the signs and symptoms of inflammation. And then, of course, the risk of heart disease and the risk of diabetes and all things that will help. So separate micronutrients from prebiotics and probiotics. Tell them overall health improves, absorption will also improve. But sometimes, even with the absorption improving, iron may not be available because it depends on the quality of the iron. So even under prebiotics or iron or minerals or micronutrients, what we need to focus is the quality over quantity. Also, the dynamics that play. And I said, even the pectins, or even if you look at oligosaccharides, that's sugars, basically sugars, but different links of sugar. So they're not bad because it's a different quality of sugar that helps in the growth of the bacteria. So I think the question that you asked me was, can prebiotics help in gut microbiota? Yes. Will it help iron and B12 absorption? Maybe, maybe not. Would interventions and modulations of the gut microbiota be useful? Definitely, no questions. They have to be there. And how does this knowledge be translated is something that we have to keep working, discussing with our colleagues. Never be in silos. Don't keep the knowledge to yourself. Have a meeting and find out how you can do. And I'll leave a small story here. I was in India, and when I visit a shop very often, and this sales guy was very sad. He's a very enthusiastic salesperson, but something was working on his mind. And I asked him, what happened? He said, my daughter is about 11. She's just lost her appetite. I said, what happened? He said, I've taken to all the doctors. And so they went through a series of tests. And I recommended the nutritionist I know. I said, go to Shiny for diet recommendations, go to an endocrinologist and things like that. And finally, they diagnosed Crohn's disease. And then how do you help them? And then immediately I said, okay, there's a lot of inflammation. So they had to use an anti-inflammatory route. So what do you give them? I cannot tell them it's inflammation. It is, use prebiotic. You have to simplify that to them. And therefore, how does a nutritionist or a dietitian or a practicing nurse or who it is, how do you take this wealth of knowledge and always simplify it to say, what is gut health is very important. Why is gut health important? And then do not put too many things and mix it up. So therefore, this question actually can be confusing because we're talking about a gut health with prebiotics and probiotics. And if you talk about mineral absorption, especially B12 or even iron, we've always been told fiber inhibits iron absorption. And suddenly a new science comes up and tells you that the fiber is going to help in mineral absorption. So these have to be very detailed. And I think at our level of practice, at our level of interface, I think we need to have it simple. And maybe if it permits us, we need to do personalized nutrition. When the moment you're handling gut microbiome, you're handling prebiotics, if you can do a personalized nutrition where you can actually read more into the person and give a precise and a personal nutrition recommendation. Thank you.
Thank you so much, Malika ma'am. I think it's very true. Thank you for demystifying that. Yes, today our understanding is different and it's better. That we focus on improving gut health and enriching it. Absorption of nutrients, both macro and micro, will improve for sure. Ma'am, my next question is now to Neerja ma'am. Neerja ma'am, today there is a lot of confusion around probiotics. And most often it is confused for lactic acid bacteria in fermented foods. Ma'am, what is the difference between probiotic supplements and traditional fermented foods? And how do you suggest that we as practicing dietitians today address it and choose the best probiotic for our patients that are available in the market?
Thank you, Sheetal, for that question. And yes, ever since I think probiotics were introduced into India, there has been that confusion around traditional fermented foods being probiotic. Of course, we cannot undermine the importance of traditional fermented foods. I mean, our curd, our buttermilk, and whatever we have, they give us nutrition, calcium, vitamins, proteins, all of that. But they are not standardized products. So when you look at a probiotic, it is very, very important that the lactic acid bacteria has to be scientifically tested for its ability to transit the GI tract, the gastrointestinal tract, in very large numbers. So it has to be able to tolerate the gastric acid, the bile, the pancreatic juices, and reach the target site, which could be the small intestine or the large intestine, in very large numbers to give you a scientifically proven health benefit. So while traditional fermented foods have lactic acid bacteria, but it is quite possible that these lactic acid bacteria do not survive in the stomach and are therefore unable to reach the intestine live to impart a scientifically proven health benefit. And so today, if you see in the Indian market, you have a curd and you have a probiotic curd. So the curd is what you have as a fermented dairy product, but a probiotic curd has a specific scientific probiotic strain, which is indicated on the pack of on the product package. So what also happened was that in 2011, because there were so many probiotic products in the Indian market, and there was this confusion between probiotic products and, your traditional fermented foods, the Indian Council of Medical Research and Department of Biotechnology brought out guidelines for probiotic foods. So in those guidelines, which were published in 2011 in the Indian Journal of Medical Research, they have clearly indicated what it takes for a strain or a product to classify as a probiotic. So it is very important to identify the probiotic bacteria, and this is done through phenotypic or genotypic tests. Then you have to assess the safety of the probiotic in an animal model, then the efficacy of the probiotic in an animal as well as in a human model, and then formulate that particular probiotic bacteria into a product. So they also had labeling requirement for a probiotic product where it was important to mention the complete name of the bacteria, the viable count till end of shelf life, and the scientifically proven health benefits. And now the Food Safety Standards Authority of India also has brought out regulations for probiotic foods where they've clearly stated that any product which calls or which is classified as a probiotic must contain at least 10 to the power 8 cell-forming unit of the probiotic bacteria per recommended serving size per day. It must mention the complete name of the bacteria, must give you the viable count of the bacteria and the scientifically proven health benefits. And because most of these probiotics are available in the form of foods, you cannot make claims regarding treatment, prevention, or curing of a particular disease. So they are absolutely not for prevention or treatment of a disease, but generally to improve your overall gut health and your immunity. So that is the difference between traditional fermented foods and probiotic foods, which are there in the market.
Thank you. Thank you so very much, Neerja ma'am. I think it's very important today, that we understand and we also learn about our options and choose the best options for our patients and recommend them, because they do look to us and ask, okay, which third should I choose? And today there are many available.
Yes.
Thank you so very much, Neerja ma'am. Shovan sir, my next.
Sheetal, you're on mute. Sheetal, you're on mute.
Yes, sorry, sir. Thank you so very much, Neerja ma'am. It was really a very insightful conversation. And I'll just quickly, in the interest of time, move on to Shovan sir, ma'am. Shovan sir, in the context of gut intelligence, what novel research or technologies are emerging to better understand and measure the impact of gut microbiota on overall health?
Yeah, thanks. And I'll because the time is short, I'll just go into my passion area. And one of that, and Dr. Sasikiran really covered some of that. And this is about the whole area of polyphenol and health. And I had worked a long time on tea and health, and we were struggling to find the benefits of the antioxidants, because in the plasma you'll get very little less amount of the polyphenol metabolites. But one of the new things that we are realizing as we are doing work with the students is with the traditional ingredients from the traditional diets, things like Triphala and Amla, some of those metabolites are actually converted in the gut by the microbes, and they are converted into a metabolite called urolithin A. And this urolithin A has again done a lot of good work has been done in the area of pomegranate, where they have shown the benefit of the metabolite. It's a gut metabolite of ellagic acid, which is one of the polyphenols in pomegranate and also in Amla and Triphala. These ellagic acid is converted into urolithin A, and urolithin A has been proven to have health benefits in terms of vascular health, as well as in terms of their good evidence in terms of anti-aging. So people like me need it. And I think the whole excitement, and that's what gets me excited, is the area really expands when the scientific techniques increases, and the whole area of microbiomics now is filled with omic science, which is it's a combination of metabolomics, which is using high-end measurement techniques, as well as in terms of the metabolite analysis, again using very high-end techniques. So this whole area is rapidly growing, and I'm really following it and sharing my excitement with the Good Monk team and with my students in the university.
Thank you, sir. Today, I think a lot of our dietitians have done the TDU course on nutrition and Ayurveda. So we also do look forward to learning and then incorporating herbs in our practice for our patients. My next question is now to Sasikaran sir. Sir, there are a lot of questions for you. If I would request you to, shed some light. How does the gut-brain axis influence mental health, neurological disorders, and cognitive function?
This is actually a new discovery. We already knew that the brain communicates to the gut through the vagus nerve. And but now what's interesting is that these gut bacteria, when they produce the short-chain fatty acids, there are also some substrates on which they ferment and produce neurotransmitters, which are like the gamma-aminobutyric acid or serotonin, norepinephrine, and so on. So what are these neurotransmitters doing in the gut? So they could do two things. One, they get absorbed into the blood circulation and then proceed towards the brain or anywhere else, and then stimulate, or they may be stimulating the neurons. You have the myenteric plexus, which are the neuronal cells which are in between the muscle layers and the submucosal part of the intestine. And these neurons, when they get triggered, they are communicating through the parasympathetic and sympathetic nervous chain through the vagus nerve, and then the vagus nerve, vagus nerve is one nerve which sends stimulus from the brain to the gut and also from the gut to the brain. So in the reverse direction, it is obviously communicating with the brain. And so once we know now that there is a communication of the gut and the brain, scientists are now trying to find out whether some of the neurological problems, like the autism spectrum disorders or the cognitive decline in the elderly, or even some of the neurodegenerative disorders, could have originated because of a malfunction in the gut, which means because of the wrong kind of foods. So some evidence has come from the fact that autism children have got an unhealthy gut, in the sense whether this is because of their unhealthy diets or it was the primary event, that we still need to actually find out. But there are studies where they found that when they gave probiotics and they also gave right kind of prebiotics, some of the ASD children, the disease did not disappear, but certainly the symptoms became milder. And the children's behavior also was more towards normal. So this gives us hope that we could actually communicate to the brain through the gut. And with using the same principle, we also find that the cognitive decline in the elderly is one of the main problems, and this is because of certain changes of degenerating neurons in the brain. Now, whether this gets accelerated because of the bad diets, and this is what is worrying us now, whether this non-communicable diseases, which is associated with ultra-processed food or the wrong kind of food, which totally cause dysbiosis in the gut, which in turn may change the neurotransmitter, signals from the gut to the brain, and maybe the signals come down. That's my hypothesis is that in a normal gut with normal bacterial activity, the normal signals will be going to the brain, keeping the brain active. Okay. But once the wrong kind of food goes, the wrong bacteria go, maybe the signals either are not going to the brain or the wrong signals are going there. We still do not know. These are all highly hypothetical. But there is evidence to show that in elderly with cognitive decline, by dietary manipulation, whether you improving the gut health and by probiotics, some amount of cognitive decline can be prevented. So this is now, there is enough scientific evidence that something is happening there, but not enough for us to recommend anything.
So, sir, if someone has a poor diet and doesn't take care, is it possible that they could get, neurological disorders like Alzheimer's or dementia earlier, or the risk to that would be higher?
I don't know. That's what we are trying to find out. So there is a link between the diet, gut health, and the brain now. So that link needs to be now better understood through good studies. And because too early days, give us another couple of decades, and there will be a diet or a probiotic bacteria which will be given to older people to prevent cognitive decline.
Thank you.
There is a study too for omega-3 having a beneficial effect on dementia and Parkinson. Yes.
So, omega-3 also benefits the gut bacteria.
Yeah. So that's all. That's so important.
Mm.
Also, Dr. Shashikaran, there is a study which showed that constipation increases the risk of Parkinson's disease.
Mm.
So there is that link that people who are constipated are higher. Yes.
Prebiotics and probiotics again.
To improve your bowel, to improve gut motility and improve bowel movement. So people who are constipated are at greater risk of neurological disorders, particularly Parkinson's disease.
Yeah, Dr. Neera, we've seen a lot of benefit with constipation and diarrhea, both with probiotics. So a lot of, I think, myths and facts have been addressed by all of us. And I think those myths about are all probiotics same or not, are pre-fermented food probiotics or not. So all those have really been addressed, which will help all the dietetics group to handle them.
So
and the is too much of it is okay. Somebody starts taking too much of it because it's good. So those
another myth which is there, which is that, probiotic bacteria, they are transient colonizers. So once you consume a probiotic product, that bacteria is going to grow for some time, impart its health benefit, and they get passed out with the feces. So regular consumption becomes very important. So, I mean, you need to consume probiotics regularly for the benefit. And therefore, even if you have a little extra probiotic in terms of numbers, they are ultimately going to get passed out with they don't become a part of your intestinal microbiota for sure.
Or
Does
you
it have an
consume
immediate effect,
prebiotics.
Dr. Sasikaran? I mean, Nita also, I suppose you take probiotics today, would you see the benefit immediately? Or is that also a myth?
That's a myth.
So it will take some time.
It takes at least a minimum of 3 weeks for you to begin to see benefit with a particular probiotic.
Ma'am,
That's
there was
it.
also a very important question that a lot of dietitians ask is that after I stop the probiotic, then how long would it actually be there in the intestine? We did some Google search and some research. The answer that we got was 1 to 3 weeks. Ma'am, what is your take
You're
on it?
right, Sheetal. So even when you look at consuming a particular probiotic, say I'm consuming 10 billion bacteria, tomorrow if you were to do a fecal flora analysis, it's not going to be 10 billion. So it's going to take you at least about 3 weeks for the bacterial count to increase to that number. And just as it increases so slowly, it's going to decline also, in the same manner. So once you stop taking a probiotic, very slowly the number of bacteria are going to start declining. And by about end of 3 weeks, you will not find that probiotic bacteria in the,
So
when you do a stool analysis.
जादू की छड़ी नहीं है कि अभी खाए
It's
और
not
अभी
a-
result. Yeah.
It's
No,
not
no,
a
I-
medicine.
Expect, I had
It's not a
it, so
medicine.
results.
It's not a
would
medicine.
I would
It's not.
suggest you.
I have a question, and I thought I'll just clarify. As we do a lot of innovations from a product size, I think some companies are doing their best to get probiotics that actually withstand the journey through the gastric juice and survive. And this is where I would like Neeraj to help me out with my ignorance, is we have you have said that the regulation actually says what is the colony size that it should be there for a product claim. And sometimes we go a little beyond that. So when I was consulting for GNC, they had probiotics of different things for beginners, for people who are used to it and have started prebiotic, and for very acute conditions where they're really sick, hospitalized, have to recover. So that was a huge dosage. Now, when we use innovation, what we do is we learn the science and use products that are stable, and therefore they reach the small intestine and go to the large intestine. In your experience, Neeraja, when you use a high colonized a probiotic product, how much does it go to the large intestine finally?
Again, how does one understand whether the bacteria is actually colonizing the gut? Because that's important. So what you normally do is you do a stool analysis. And in some of the studies, it has been seen that you can actually isolate the same number of bacteria as were consumed. Yeah, so they can actually transit. So a very important characteristic of a probiotic is that it has to transit your GI tract and reach your intestine alive in the numbers in which it was consumed.
So nothing happens to the exposure of the gastric juice?
Nothing, it cannot happen. Otherwise, it is not a probiotic.
It's not a probiotic. That's a good question. That's one of the doubts that normally people have, because I know in the dairy products, they use a probiotic, which is which is not only heat labile, but it's in a spore form.
Spore form also. So once the spore reaches your small intestine, then the environment of the intestine allows it to. So in most of these dairy products, because they are refrigerated, the bacteria become metabolically inactive. They do not die. They become metabolically inactive. And when you consume the product and it gets the environment of the intestine in terms of pH and temperature, the bacteria start multiplying and impart their benefit. Yeah.
And that's why
There's one thing I wanted to tell Sheetal before 2 minutes is, you look at what nature does. nature initially provides the bacteria to the infant and it's born through the vaginal passage
Vaginal
or
delivery.
through the. After that, it provides the prebiotic, which is the human milk oligosaccharides for the bacteria to grow. So in clinical situation or as a dietitian, if somebody comes with any problem which needs a probiotic, you give the probiotic and prebiotic to start with, run it for 2 to 3 weeks. Then onwards, follow it up only with prebiotic to sustain the ones. So you don't have to give lifelong probiotics. You can switch initially to probiotic in the acute phase, then switch to prebiotic to let the normal gut health go.
So, Dr. Sasikaran, you are saying xylem and taking fermented foods after the initial dose for 1 month of probiotics is good for maintaining maintenance?
Maintenance, yeah, it's like a follow-up formula. Initially, you give the probiotic to get over the crisis and reset the gut bacteria. Then you give the prebiotic either as a prepared prebiotic or through diet.
Yeah.
Normal diet, so that it can continue. So that is how we have to do this.
Avoiding inflammatory foods we've seen an excellent role. When the people remove the inflammatory food from their their daily schedule, we find good results. And I found very good results with xylem, and I use probiotics a lot. So I've seen good results with using both.
And Dr. Sasikaran, even in CSEC and formula-fed babies, that's how they do it. They provide the probiotics, especially bifidobacteria, for a healthy gut and immune system. And
even for lactation, Neerja?
Yes, even for lactation.
For women who are lactating?
Yes, for women who are lactating.
But, there is a product where they give it to a newborn. It's a probiotic dosage for even a newborn. It's a 1 month package, 3 months package, and a 6 month. I forget the name of the brand. And it's the US uses it quite. The doctors recommend. So
we can't recommend in India.
Yeah,
no, for NEC, no.
Nothing till 6 months.
Breastfeeding, nothing till 9 months or 1 year of age, actually.
I think only critical care we are still very cautious and immunosuppressed patients, but otherwise feel quite comfortable using it in other diseases, diabetes or celiac and IBS. See good results with those patients. Not to say that they don't have to change the diets, but then with it as a supplementary probiotics and strain specific, we've seen good results.
Thank you so much, everyone. I am very, very thankful. We've had a very enriching panel discussion.
Can I have Richa there? Yeah.
Yes. Please may I invite Richa ma'am.
Yeah. Hi.
Richa ma'am.
Am I audible?
Yes.
Richa ma'am has 20 years of experience. She's the co-convener at IDA Delhi. She's a registered dietitian and a PhD scholar at AIIMS, New Delhi. She's also the course director for integrated care of obesity. Ma'am, over to you to help us conclude a very, very insightful and very encouraging debate with all our panelists.
Thank you so much. And at the outset, I would like to thank Indian Dietetic Association Delhi chapter for giving me a simpler job to conclude the entire session and giving the thanksgiving note to people who really worked hard to bring it possible, to make it possible today. So with this note, although all senior people are there in the panel, to conclude their talk is like, it's not so easy. But in my words, I would say, gut-brain axis is not a single link communication, which I understood from Sasikaran sir and from all the panelists, between two intelligent organs. On the contrary, it is a multi-layer communication between these two intelligent organs, and gut healthy bacteria helps in sending right messages to brain, and in return, receive good feedback mechanism to support overall health and well-being of a person. To maintain the healthy environment, prebiotic and probiotics plays a major role. And with this note, I would like to thank Indian Dietetic Association for conducting an enriching academic session. Good Monk for conceptualizing it and bringing the best faculty to do justice with the topic. All the faculties for taking out time and willingness to share their knowledge with the scientific community, and all the people, EC members who silently, sometimes people support us silently, so we shouldn't forget about their silence. And with this note, I cannot thank enough to people, because I was hearing in the initiation that more than 350 people have joined, and their energy is actually the guiding factors to conduct a very high enriching scientific program. So with this note, I thank everyone, and hope to hear Sashikaran sir and the rest of the panelists, because it's really learning session. And thank you so much to you, Sheetal, for conducting in a very nice manner. Thank you. And Nirja, you too.
Thank you, Sashikaran sir. There are still many questions. I will reach out to you by email, sir.
Sure.
Thank you. Thank you so much.
Thank you, everyone. Goodbye.
Thank you.
Thank you
Thank
so
you.
much.
Thank you, everybody,
you.
for being there.
Bye.
Bye.
Nice seeing all of
Thank you.
you. Bye.
Bye-bye.